6:31 this morning, and every Tuesday and Thursday for the past few months now, we've been joined live with an infectious disease doctor to bring you the latest updates and answer your questions on the COVID-19 pandemic.
We continue that this morning, joined again live with Dr. Dana Hawkinson from University of Kansas Health System. Doctor, as always, thank you for joining us. Good morning to you.
Hi, thank you.
So let's start with an update on COVID patients in the hospital right now. What are the numbers like?
Yeah, numbers are still in the low 20s, 22 as of last night. Again, we still have 3 people on the vent, but about 10 of those are in the ICU. So we are still seeing more people in the ICU, but we are really trying to hold back from getting patients on the ventilator because we know it's difficult to come off. We're continuing to use the therapies that we normally use that have been approved, such as the remdesivir, the steroids, and of course the anticoagulation, really to try and treat the blood clots that we know happen a lot in these patients.
Yeah, Doctor, we want to talk about the age groups COVID is affecting now. Young people contracting the virus at an alarming rate, people in their 20s leading in Johnson County with infections, even though we know that the virus necessarily doesn't infect them as severely as more vulnerable populations. What's the possible effect on other age groups, even though these younger people are being infected at a higher rate?
Yeah, like you said, again, we know that it's the 20s to 30s who are getting infected because a lot of those people are in that population are still going out to parties, large gatherings, restaurants, bars, and doing things and acting, that they shouldn't and not doing the social distancing. That can impact because, just as you stated, most of those patients, most all of them, will continue to be healthy, will not have to go to the hospital. But most of them also have contact with vulnerable populations, either their parents who may be older and may have chronic medical conditions, or their friends who may have chronic medical conditions, or other people they may know. And so through that way, they are able to maybe then spread it to those populations, and that's where the real danger comes in as well.
We've talked a lot about testing over the last few months and how invasive it is. I think a lot of people are scared to get tested, even for the first time, because of what they've heard about or seen about here on the news about the topic. I want to ask you about saliva testing, because that's a new thing people are asking about that might be possible, where you can take, instead of the Q-tip up the nose, so to speak, that small amount of saliva to be tested. Is that possible? Is it something we might be seeing more often now, or is that still a ways off to be effective?
I think it's pretty close, but again, it still takes place at a lab where you have to give your sample. We know that the gold standard, like you said, is the nasopharyngeal or NP swab. That has good validation and testing, but certainly we know that you can have viral titers or levels of virus in your saliva. So if you're able to give a saliva sample, you don't have to go through the nasopharyngeal swab process, which does feel like a brain biopsy, or it's, the swab is really stuck far up into your nose. So it will be easier. Hopefully people will be able to give a sample easier. We need to make sure that we continue to have the reagents and the test kits to be able to do the test. The other tests that are coming online are the antigen tests, which could just be a simple nasopharyngeal swab or something like we would do for an influenza test at your doctor's office, something that's rapid and quick. We do have those now, but still, at this point in time, their sensitivity, their ability to find the virus is still quite low compared to the nasopharyngeal or NP swab, the PCR test. So it's not too valid. I've heard a lot of anecdotes and stories of people and family members who have had a negative antigen test, but then later, a few days later, their confirmatory PCR is positive. So the technology still isn't there yet. The test isn't as accurate as we would like it to be.
Still so much to figure out with all of this. Dr. Hawkinson, thank you for joining us.